want to share some photos with you of this beautiful, happy family here. This is a local woman named Parvane Kalantari. She had 3 children through fertility treatments after suffering with infertility for quite a while, but she now has 3 just beautiful children. We talk about this today because it is National Infertility Awareness Week. So we'd like to welcome Parvane here to the studio, as well as Dr. Elizabeth Barbieri with the Oregon Reproductive Medicine Clinic.
Thanks for having us.
Thank you both for being here. Now, Parvane, let's start with you because you had 3 children conceived through these treatments. What is it that finally worked for you, and what was your struggle like?
My struggle was a long one and a beautiful one, and it lasted about 3 years. My son was born with injectable hormones and IUI, and then my girls were born via IVF with multiple shots.
And twin girls?
Twin girls,
wow.
11 months. Yeah.
Handful.
You mentioned the shots.
Yeah.
Before the break, we showed a picture of the needles required in your IVF treatments. And I think going in, a lot of women don't realize that. The needles are for what exactly?
To help stimulate your ovaries and produce eggs that will become embryos eventually, and just to balance your hormone levels to keep them in check. I think Dr. Barbieri will be able to answer that.
And doctor, I guess let's talk about that. I mean, I think most people would think instantly IVF as the most common or most successful treatment. Is that the case, or what are the other options?
So when we think about fertility treatments, there's simple treatments and more complex treatments. IVF is the more complex treatment. There's variations along IVF. In this day and age, in 2017, IVF has been around for about 39 years and it has tremendous success rates. So if that's the right treatment for you medically, then that's the one we'd want to provide. However, not everyone needs IVF, and we have some oral medications, some pills you can take to help produce eggs, some simple treatments like intrauterine insemination that may be effective for the right couple.
When you look at the success rates, what do you tell couples today when they walk in and they say, I want IVF? What is my chance of having a baby?
That's a great question. And at Oregon Reproductive Medicine, we're really fortunate to have an amazing embryology lab that we can offer our patients some of the best success rates in the country. For a couple where the female partner is less than 35, the success rate, whether you put in 1 embryo or 2 embryos, will be between 60 and 80% chance of having a baby. In transferring 2 embryos, there is a high chance of twins, as Parvane is a good example of. But it's really nice to be able to take a couple who's struggling with this intimate issue and say, we can help you, and we have a really good chance of accomplishing our goal.
At what point, if a couple is trying to conceive, I mean, at what point, what timeline should they be coming in to visit you? And I mean, just how common is infertility?
So infertility is surprisingly common, and I think unfortunately not as many people talk about it as I wish they would. Approximately 1 out of every 8 couples will struggle with this.
Wow.
Right? Much more common than we think. And in women less than age 35, the recommendation is that if you have not conceived after 1 year or 12 months of unprotected intercourse, you should come seek help. For women 35 and older, because we now recognize the impact of age on chances of conceiving, the recommendation is to come in after 6 months of trying. That being said, we would never turn anyone away, and I really encourage anyone who just wants information to come in and talk to us and get an evaluation.
Parvane, I'd love to give you the last word here during this Infertility Awareness Week. What do you most want couples to know dealing with this?
I want people to know that it's natural and it's common to struggle with infertility, and it's kind of become a passion of mine. I share my story very openly, and I think what really helps is talking about it. I know that so many people have reached out to me to share their stories, and I would have never known that they were struggling with infertility, and just having that group of people that you can turn to, because it is a long, very rewarding journey, but just talk about it.
Well, you really have a beautiful family.
Thank you so much.
Congratulations. Thank you both for being here today.
Thank you for having us.